So, yeah, tell me a little bit about Ayogo.
Sure. We began doing the work on the company that became Ayogo in about 2008. Ayogo, the name of the company, comes from the name of two ancient games. Ayo is one of the Mancala games from East Africa with pebbles and cups. It's actually a serious game to help pre-numerate societies develop expertise in estimating quantities. You don't have a sophisticated numbering system. It's hard to keep track of how many goats you have and that sort of thing. So you need a game to help you practice estimating. And Go, of course, is the Asian strategy game, and the only game left where human beings can consistently beat computers. So Ayogo is the name of our company, and because we believe that games are both serious, important, and ancient.
Now, how do you work this into the healthcare spectrum?
Well, because it's an ancient human behavior, I mean, we're really talking about fundamental aspects of human psychology. Everybody plays. And it's not that we're importing ideas from video games into society at large. In fact, the opposite is what's happened. Video games are taking advantage of things that we know work in all aspects of human life. If you're not progressively challenged in your career, for example, it just doesn't feel interesting. And you don't feel engaged. Everybody knows this. It's sort of a truism. That's why games work. That's why that's what games do to try to keep you engaged in the game, is they try to mimic this effect that actually comes from real life, that you need to be progressively challenged, and games are just good at isolating those sort of important aspects of human psychology, isolating them and executing them in a simple closed system.
Are healthcare providers receptive to the idea of using games and gaming technology?
Yes, I think they are. I mean, I have I have a different opinion about games and what are games and why games are important than many of my colleagues working in the game industry. I mean, I really think that it's important not to think of how we are going to make a game for healthcare. I think it's much more important to take a look at what is it that games have done so effectively to capture people's attention and keep it. Look at those lessons, those design cues, those fundamental psychological techniques that are used in games, and apply them in healthcare. For example, you wouldn't really expect to play a game that, a first-person world-exploring game where you couldn't express yourself, or you didn't see yourself in it. You expect to have an avatar, you expect to have a character, because you expect that the game is about you. It's about what you are doing in the world. And of course, healthcare applications are about you. There's nothing more fundamentally about you than your health. But how many health applications have you ever used that asked you to create an avatar for yourself? To see your own face in the application is sort of an obvious thing. And to exclude it flies in the face of everything we know about human psychology. And yet, healthcare applications will provide a environment that doesn't really talk to you about you. It talks to you about your condition. It talks to you about your hospital. It talks to you about your healthcare, but it never says anything about you. People don't see themselves. So it's not about building whole game systems for healthcare. It's about using what we know works in the game sphere, importing it into healthcare applications and doing it there. So we like to say we build healthcare applications that use game psychology. We don't build games for healthcare.
So this isn't like creating a Madden, or taking a Madden game or a Halo game or anything like that and developing a healthcare a use out of it.
No, I mean, I think that there are people who are trying to do those kinds of things. I'm not going to say that there's no utility in doing something like that, but I really think that the problem, as I see it, is that we're trying to solve is much bigger, and the opportunity we have is much bigger than that. That kind of game, video games, are really just a small segment of what play is overall. I mean, my mother, 82 years old, she's a serious gamer. She plays bridge, and she plays it every week, and she's really dedicated to it. And it's a social environment for her. If you want to talk to her and reach her and speak to her about important things, well, you do it sitting around the table with her friends playing bridge. And it's those kinds of lessons about games and play that are really universal and going to cut across all age and income demographics. It's those things that I think are really most useful for us to analyze, and we're looking at how to apply this to healthcare.
Yeah. One of the big populations that gaming applies to especially in healthcare, is chronic conditions.
Absolutely, yes.
How would you work a game into a specific chronic condition, or what would it address? What would the game address to, say, someone with diabetes?
Sure. Well, first of all, I'd say it's important to try not to do too much. We don't need to boil the ocean here. I mean, there are really, obviously, so we're talking about enormous problems. Some of the biggest problems humanity's ever faced. We have hundreds of millions of people with these chronic conditions. So it's easy to kind of get ahead of yourself and try to do too much. I think we focus on solvable problems, things that we know work, where there's good, solid, peer-reviewed science, where we can see that there are outcomes. Now, it's not really clear that we can build an application that somebody will say use consistently over the course of 3 or 5 years. I mean, we just haven't been doing it for long enough to say that we can do it. I think we may be able to do it. There's not a lot of proof that it's possible, but we do know that we can engage people for 3 and 6 months, which is about the right amount of time if you want to help them develop a new habit, say. A simple new habit. Let's just try to focus on simple things. So we've built an application recently with one of our partners who work with Merck, designed to help people who are newly diagnosed with type 2 diabetes, over the course of 90 days, absorb a curriculum to help them get their diabetes under control initially. So often you're diagnosed and you get this fire hose of information. It's very hard to absorb. It's very hard to make it actionable. So our application uses the techniques that you often see in social games of the type you might find on Facebook, or casual games on your iPhone, to feed you the information you need to know about getting your diabetes under control, just a little piece at a time, every day. Kind of a steady patter, steady drumbeat to help you build a meta habit, about thinking a little bit about it every day. Here's a new behavior for you to adopt. Here's how you keep track of your medication. Just one thing at a time, and to help you do it just a little bit at a time over the course of about 60 to 90 days to build some new habits, and then you're done. And then you can go on to the next segment. So, it's very hard for people to think more than 90 days in the future. You don't really plan your life like that. True. So let's just focus on near-term horizons that are easy for people to absorb, get good outcomes in the short term, and then move on to the next challenge.
Is that the ideal length for a game? That type of setup where you're working on it for 90 days?
Yes, when we're talking about engaging people over longer periods of time, and then we do build applications that aim to do that, we don't typically use game mechanics to try to do that. We use social mechanics. Yeah. People get engaged over longer periods of time in things that are important to them socially. Other human beings, are more interesting than any software you can create. So if you want people to be engaged over longer periods of time, you really need social environments. But to get them engaged in short-term activities, projects, game mechanics are very good for that. And so this is sort of how we split our design team and how we split our design thinking is what are the mechanics to get people to do things sort of in the short term, in the sort of immediate things, and what are the mechanics, the social mechanics that we use to get people to make an emotional investment in a system or a space that can be carried over a longer period of time.
What are some of the areas that you're looking at now, or that are being pitched to you now for games in healthcare?
There's again, it's easy to sort of find yourself in a position where you're trying to boil the ocean. I mean, there's so many things to do, and we're just a relatively small company. But we have been doing a lot of work just over the last few years, and we have some exciting projects going on right now that are related to adolescent obesity. And of course, these are sort of precursors to diabetes and other kinds of conditions. So trying to move a little bit farther upstream, and those have been really interesting projects and fascinating. Those are important. Sort of at the other end of the scale, we've been doing some work with the University of Birmingham around dementia, and that's a particularly interesting application. And I bring it up just because it's a little bit counterintuitive in some ways, that these games that we build around this application around dementia are not designed for the patient. They're designed for the patient's social network. So one of the issues with dementia is not so much that you are in this sort of state of cognitive decline, which really, when you think about it in terms of a person's life, is kind of inevitable, really. But you don't need to feel isolated. So you don't need to feel unhappy. You don't need to feel alone. And what happens is, as people's faculties begin to decline, their family members and their caregivers, they don't know what to do anymore. This person is changing, and they need to change their behavior, but they don't really know how. So it's an opportunity for us to use what we know about social play and social mechanics to create a context for their family members where they have things that they can do. They have things that they can begin to do together and change their behavior just a little bit to make it easier for them to engage with the patient and help the patient feel more engaged in a more kind of structured environment.
So games for the caregivers as
That's
well.
right, yeah.
How about games for doctors?
Yes, well, of course, when you're talking about healthcare, it's important to involve the doctors at least. So certainly in our applications, whether for adults or children, there's an interface for the clinician to be involved. We're just working on an application for children who have type 1 diabetes to help them get more engaged in the management of their condition. And there is a user interface for the clinician to come and influence the game, to influence the game economy, to step in and provide rewards at particular times, to keep track of how the child is doing and provide feedback. Of course, to get analytics, to see how an individual patient is doing or how a group of patients are doing by themselves and relative to each other. We don't typically build games for healthcare providers directly or solely, although I say not typically, because we have done a little bit of work like that, but usually it's sort of an event-based game to get everybody to some new educational project.
Well, thank you very much. Really appreciate this.
Oh, thanks. It was a pleasure.